Hi everybody, I'm Dr. Joanne Gordon with Natural Health Works, and I'm here today to talk to you about hormones and health and what we can do to help decrease your inflammation in the body. So I am a naturopathic doctor and I work with patients with their hormones and also regenerative medicine, primarily PRP, which is platelet-rich plasma, so treat people for neck pain, back pain. So I see a lot of pain patients and I also work with them on their hormones. So this week I had a patient come in and she was coming in for her hip. She has hip osteoarthritis. We were looking at her blood work and we noticed that her cholesterol level was really high, her blood sugar was high. And so what that means is that we want to, and then also her triglycerides. So triglycerides were high, very much related to diet. So when we are talking about diet, and hormones, the main hormone that we're thinking about is insulin. And insulin is the hormone I want to talk about today. Insulin is a hormone that pulls the sugar from the bloodstream into the cells, and if insulin levels are high, it's going to cause inflammation, it's going to cause heart disease, it's going to cause osteoarthritis, it causes gout. Women with PCOS, they tend to have very high insulin levels, and so they become insulin resistant. And so when you're insulin resistant, that means you need more insulin to be put out to help get the glucose out of the blood. So insulin is directly related to what we eat, and certain foods, people consider, carbs, protein, fat in the food. So insulin is going to get secreted mostly with the carbohydrates and protein. So even though certain foods don't have high carbs like chicken, fish, and steak, it's a very low carb, it's still going to increase your insulin. And other foods that you wouldn't think would increase insulin that have no sugar, no carbs is diet soda. So diet soda will also increase your insulin. So we don't like when insulin goes up. When insulin is high, people get fat. So we don't want to get fat, and we want to decrease inflammation. So insulin increases inflammation as well. So those are a couple of things that we want to think about when we're eating, is trying to lower our insulin. When you test for insulin, you always want to do a fasting blood insulin. The levels of insulin are between 3 and 8. So if your level is above 8, it's definitely too high, and that's going to probably put you at risk for diabetes. Insulin, I mentioned before, is in response to what we eat. Certain foods will increase our insulin. We can't really determine, like if I eat a piece of bread, I'm going to have a certain amount of insulin put out to help pull the sugar, and then if you're eating a piece of bread, it's going to be different. So everyone's insulin is a little bit different, and that's why we call it personalized medicine. Another great thing that I learned is that when insulin levels are high, a lot of times they can affect your thyroid. So insulin has a direct effect on thyroid function, and it can cause people to be, the thyroid not to work as well, so they get hypothyroid, and then they're needing more thyroid medication. And they actually had a person change her diet, and she had to reduce her thyroid medication, so that was pretty exciting. And one great way to treat insulin as well is to reduce the number of meals that we're having during the day. I've been counseling my patients on intermittent fasting. I've had a few patients with some really incredible results with that. So if you have any kind of insulin resistance, one way to reduce that is through intermittent fasting. And with intermittent fasting, you can do that either a 12-hour fast, which would be like, you stop eating at 7 o'clock at night and you don't eat again until 7 o'clock the next morning. That's considered a 12-hour fast. If you want to take it a step further, what you want to do is go to a 16-hour fast. So you just eat a little bit later in the morning, and so you'd eat during an 8-hour period. So it's called a 16-8. And then if you want to take it further from that, you can do a 18-6, which is you're eating 6 hours. And I've seen people do really well. People are definitely losing weight. Their hemoglobin A1C numbers are going down, which is a measure of blood sugar over a 3-month period of time. So I just really wanted to talk about that. I'm pretty passionate about reducing inflammation in the body, getting people's diets healthier, because I've been preaching for 20 years wheat, dairy, and sugar. So we don't want to have that. And so I'm at the office. And so and just adding in this paradigm shift of trying to keep the insulin levels low. So that's it for today, really, in a nutshell. I just want to share that with you. Hope you guys are doing great. I'm really interested in helping you feel better, transforming the health of our community, and that means you. Thanks so much for listening, and talk to you soon.